Is there a diagnosis for a client that doesn't have a specific mental health disorder? Sorta. We call them adjustment disorders. A therapist would diagnose an adjustment disorder when a client is not showing pervasive symptoms of a depressive or anxiety disorder or personality disorder. Then we would say maybe they're going through a transitional period in their life. It has to be within 6 months, I think it is. I think it's 6 months. Oh my gosh, I would have to look at the DSM 5. I believe it's 6 months. Like if you're just experiencing a lot of chronic stress all of a sudden, or you're starting to have some sort of anxiety, you never had anxiety before, you didn't grow up very anxious, like you never had this problem as a teenager, you don't have childhood trauma, you have no issues with your family really. It's more so, oh, Jazz, I just moved, or I got a new job and I'm really stressed about that job. Then we would say, okay, maybe an adjustment disorder with like anxious symptoms. Or you're sad because you moved and you don't have your friends and family anymore from back home. So then we'll say adjustment disorder with depressive like symptoms. And then as we spend more and more time and we get to know the client, right? The client might also say, "Oh, wait, but there was that time in as a teen I was really sad for for like 2 years. And then I got sad again in college." And then it went away and then it came back. So we would be like, okay, maybe you have major depressive disorder and it's this chronic issue, mild, something like that. Really, though, I always try to say the diagnosis isn't as important as maybe people think. Really, the diagnosis is for other therapists to talk to other therapists and other doctors so that they know exactly what we're talking about and the collective symptoms that go with that disorder. And then it helps for insurance purposes. If you go to a therapist, and a lot of people do this, they go to a therapist and pay self-pay. They do that because they don't want a paper trail of their diagnosis following them around. So they would do like a self-pay and not have to worry about like diagnosis or like their job seeing it or something like that. But I think that's interesting because what it does say is that mental health disorders aren't disorders until there's a pervasive pattern. So we're talking about time and duration of these intense symptoms that have gone throughout your whole life. If it hasn't been something that's been, following you along, then it could just be an adjustment disorder. You could have be going through bereavement or grief or something like that. And that's something that a lot of people go through, right? We all get sad, we all get anxious from time to time, but it becomes a problem when we're anxious for 2 weeks and more, right? Or we're depressed for 2 weeks and more. So it really is about the time and the intensity.